because home matters. Too many children and youth lack a fixed, secure, safe place to live. And we know from research that children who lack housing stability are generally at a much greater disadvantage for academic failure because of that instability in the home compared to their typically stably housed peers.
Reaching home matters to me because it helps my children and our families achieve permanency, stability, and self-respect.
I can't say enough about the work Reaching Home has done in collaboration with the branch's Court Support Services Division in identifying and obtaining additional housing resources for our homeless population because it really assists our probation officers, especially with our younger population, the 16 to 22-year-olds who are homeless, to get them stabilized housing.
Reaching Home is important in my work as Medicaid director because in order to use health services effectively, people have to be stably housed.
When the question came to us about an opportunity to talk about this, we reached out to our social workers in our hospital and asked them the question, for the families and patients that they work with, what matters most to Reaching Home for them? And I thought it would be best to share in their words how that related to their working with people with severe and persistent mental illness. For the homeless, Reaching Home matters because no one would argue that shelter is a basic human need. Having a permanent, stable space to call our own is critical to our sense of safety, security, and well-being.
Reaching Home is important because when we invest in housing, we invest in the communities surrounding our schools and in vibrant neighborhoods that our students call home.
Reaching Home is important to my work at the Bureau of Rehabilitation Services because the campaign is connecting employment services and resources to Connecticut's most vulnerable populations.
Reaching Home is important to the work of the Connecticut Hospital Association because stable housing is essential to maintaining health. This work is critical to CHA's mission to eliminate health disparities and improve the health of all Connecticut citizens.
Reaching Home is important to my work as I chair the youth work group of the Reaching Home campaign. One of the pieces of work related to youth homelessness is really about making awareness about youth who are homeless and creating change. Before Reaching Home, a group of us had been working together to deal with this issue, but we had not had the same impact and the same connectedness about this issue that we do have now through Reaching Home.
What has become abundantly clear to me is that there is a strong intersection between the homeless population and that super user group that we've identified, and that when we are able to connect people to supportive housing, their healthcare issues become more manageable and they're more connected to community services.
Reaching Home is important to my work because they're one of our most important partners, because they bring a whole host of others who all care deeply about the health of our communities. And we know that having safe, stable, and affordable housing is a prerequisite to the health and wellness of the people that we serve with mental health and substance use issues.
It makes absolute sense for us as public servants to make sure everyone who wants a job in this state and who needs a home and needs to be sheltered and educated and trained can have those initiatives for them. I just can't imagine what it'd be like not to have a home to go to at the end of the day, or a place to rest my head and concentrate on my next day's activities. If I'm spending 90% of my time and energy trying to find out where I'm going to sleep at night, I won't be productive for anyone in the next day or in the near future.
Because we know that home matters.